Hello, everyone. Welcome to the Community Rec Magazine Virtual Roundtable. Today, we'll be discussing the COVID-19 crisis, and hopefully we'll be able to shed some light on how to navigate through the crisis successfully. I'm Bobby Dyer, the editor of Community Rec Magazine, and I'll be today's moderator. On our panel today, we have John Mikos, the president and CEO of the YMCA of Greater Kansas City, Kevin Mitchell, the Director of Parks and Recreation for the Rec of Grapevine in Grapevine, Texas, and Beth Siegel, the Chief Program Officer at the CATS JCC in Cherry Hill, New Jersey. Scott Henderson, the Director of Parks and Recreation for the Provo Recreation Center in Provo, Utah, had to tend to an emergency minutes before we were supposed to log on, so unfortunately, he won't be joining us today. But here's how it's going to work in this roundtable. We'll take about 30 minutes for a moderated Q&A, and then we'll open up the floor to questions from the audience. So to our listeners, please submit any questions you have as they arise on the GoToWebinar control panel, and we'll take time to answer as many as we can in the last 30 minutes. We likely won't be able to get to everyone's questions, but I'll do my best to get to as many as possible. All right, let's dive in. John, I'm going to start with you. If you could just kind of give a brief summary of your experiences from the COVID-19 shutdowns, when the facility had to close, what happened with your staff, et cetera, and then we'll go down the line from there.
Well, terrific. Well, thank you for having us on. Appreciate everyone tuning in and being involved. We certainly are very thankful to be able to share some of our experiences that we have here. Just as a brief overview of the YMCA of Greater Kansas City, we serve 7 different counties with at least 12 facilities operating in 2 different states, for the state of Kansas and Missouri. So we have lots of logistics and different rules that are being applied in our area. And so back on March 15th, when a lot of things started coming out in terms of the escalation of COVID-19, we started making some decisions ahead of any announcements regarding possible closures or stay-at-home orders. We got together with our staff as well as our board of directors and some of our health department officials to really talk about, what the future might look like with keeping our facilities open. Around the same time was in March, we also were in preparation for getting ready to start spring break camp for multiple schools in the area. And like many other communities, in our community, both in Kansas and Missouri, we ended up having to close our spring break camps because the schools ended up using that time period in order to be able to keep the schools closed. So we had lots of different conversations about child care programs as well as our facility closures. And we got out ahead of it and decided and made a decision on actually March 14th, that beginning on March 15th, that we would self-impose a closure on all of our facilities that very next morning.
Okay. Beth, what happened at the CATS JCC?
Very similar, and our last day also was March 15th at 4 p.m. And we shut our doors to our staff and our membership on that day, and really have been totally isolated, have been a small crew in our building taking care of sanitation and much needed repairs that we were able to do now that the building was closed. But same thing, we were in spring break time. We were preparing to have a building full of kids for spring break activities, and all of the world kind of shut down in a moment. And it seems that time frame of that date was really it for our region.
Okay. And Kevin, can you share some of your experiences?
Very similar to that. Friday the 13th, we also made the decision that day that we would start reducing services. That was spring break for us as well. We're surrounded by many cities. They all have different spring breaks. So we serve a little bit larger population other than just our city. We had made the decision that day to make an announcement that all of our, what we call active adults, our older population, we would terminate those services effective lunch that Friday. So we went in and made announcements to them, and then consequently the next week we closed everything. It has been a benefit. We have kept everyone employed. Same thing, as Beth mentioned, a lot of deferred maintenance has been taken care of. not only inside the facilities, but at our aquatic parks and other facilities as well. So as I've said since day one, we're making great lemonade out of some lemons right now. It's getting old though, I will agree.
Right. Yeah, with so many people sitting in their living rooms probably watching this, I know everyone's itching to get back out in the world. Kevin, we'll stay with you. What, in your experience, what has been the financial impact of these shutdowns, and how are you finding ways to overcome any of those challenges?
I would say the impact has been devastating financially, where every source of revenue that was coming into the system has halted. It was kind of fortuitous. We got our NRPA look at yesterday talking about our revenue per capita, and we're like 12 times the average. So revenue is key for us. You know, we have a lot of things on auto drafts and auto payments. We made the decision to go ahead and halt those, knowing full well that we weren't going to be able to provide those services. But I would say it's in the hundreds of thousands a month easily that we are losing and will be losing for the foreseeable future.
John, can you weigh in?
Yeah, I'll talk a little bit about that. Certainly, it has been a significant issue for the YMCA. We've spent the last month nationally working on a lot of advocacy work in DC as it relates to a lot of the relief programs for nonprofits, not to be forgotten as part of funding sources. Several nonprofits across the country haven't been able to get some relief through the payroll protection program and some other relief types of services. Unfortunately, RY doesn't meet most of the thresholds for any of the relief options that are available. This includes the payroll protection program because of the number of employees we have. We're over the 500 threshold. So certainly that changes things a little bit for us in terms of what we're eligible for. The second thing, as it relates to unemployment, RY is also self-funded for unemployment on top of that. So looking at it from a layoff perspective, the financial impact for the organization to go through a traditional furlough or layoff would also create financial burden within the organization. So we did spend a lot of time between March 15th and probably April 1st to really take a look at the financial implications of what this meant for the Y in terms of membership revenue, program revenue, child care revenue, sports programming, and we can talk a little bit more about that later before we made any decisions to take any action related to what the financial impact would be on the organization. While all this is kind of going on, we're also trying to respond to the community for essential child care services, which started within 5 or 6 days after we announced our closure, which has its own implications related to the financial costs and barriers while still trying to maintain child care services and while at the same time not having revenue streams coming in to be able to cover overhead structure.
Okay. And Beth, what's been your experience?
Very similar to both Kevin and John. You know, you go from being a vibrant facility and agency with, you know, hundreds and hundreds of members and guests coming through your doors daily to zero, to nothing. And so you cannot be charging membership fees because you're not providing a service. You know, we're asking people to continue to contribute to support the agency that they love and, you know, the community gathering place. But, you know, we're losing, you know, tons of dollars, you know, weekly, monthly by not having those EFTs and those fee-for-service programs happening in our early childhood families not having school right now. It's devastating. It's devastating, and it's hard to know that you're not servicing the members that you exist for. They're your families, and it's very hard knowing that, you know, your second family, which is your staff, who you spend more time with than you do your own family in a lot of cases, you know, are hurting right now because they're unemployed. It's very difficult.
Absolutely. John, we'll go back to you. In this time, how have you been able to cut costs aside from laying off or furloughing staff members?
Yeah, so let me kind of put this in kind of buckets to start off with. We have approximately 2,000 employees, a lot of those that are part-time. We have part-time employees, those that are full-time, and those that are exempt, program directors and other executive directors operating. To start off with, I'd mentioned that we were called to provide a lot of essential childcare services in our community. So we repurposed several of our facilities into that used to be regular membership type facilities for wellness and those type of services into childcare facilities. And actually worked with members of our community to look at getting some contributions to help pay for some of those essential childcare. And that would be primarily for our hospital systems, mostly the ones that are safety net hospitals that are in our area, first responders, and other type of healthcare workers. So we wanted to ensure that we maintain that staffing structure in place to be able to deliver those services. We're serving about 100 children per day in essential child care, just covering our direct costs, while at the same, and then collectively, there's been about 200 families that have been served by doing essential child care. To your question regarding on the staffing side of it, we started looking at our staffing model of what it would look like. We projected possibly June as a possible reopening date, and we started looking at, well, based on what we think things are going to look like with scaled opening, this might be a good time for us to start looking at identifying those staff that we want to keep and those that won't make sense for us at some point into the future. So we ended up retaining about 161 of the 195 full-time staff and started paying them. We asked them to stay at home and do nothing because we weren't eligible for other types of funding. But one thing that was available as part of the CARES Act is the ability to be able to get payroll tax credits into the future. And I believe that amount was approximately $5,000 per quarter that you're able to ask for in the future by maintaining your employees. So we have a lot of our staff that we continue to pay, and at some point we'll be asking for a little bit of a payroll tax credit to be able to help with that.
Okay. Kevin, how have you been cutting costs at the Rec of Grapevine?
Quite frankly, we haven't. We have continued paying all staff, full-time, part-time. We haven't been paying casual or temporary. What we've done with most of the part-time employees is we've created a phone bank essentially for all city services that our part-time staff is managing for us. So it could be rent assistance, it could be business assistance, really a centralized hub for anything you would need. We call it Grapevine Cares. When the call volume is low, then what we do is we flip it and we have them starting calling different lists from churches or our senior citizen centers, just as touch points to provide that connection to the community. All full-time staff have been working remotely for the most part, but as I said, most have been out. Take, for example, our concession stand workers that are part-time. During all this as well, our lake was flooded 18 feet, right when when it rained, it literally poured for us. So we're coming off cleaning up all our 1,500 acres of lake parks from a flood. So we essentially mobilized that entire workforce out into the parks to start cleaning and having those parks ready and prepared for when we can safely open them. So we really haven't cut costs. We probably haven't done as much capital expenditures as we would have liked, but it's been somewhat on the spending side, business as normal.
Okay, excellent. And Beth, can you weigh in on this?
Sure. We laid off our staff in phases. All of our part-time staff were laid off first, and our full-time staff that we kept full-time all took a pay cut based on a percentage, depending on what your hourly wage was or is. Some of our staff were reduced hours. So if you were a 35-hour work a week employee, you went to 26, 25, or 15, depending on the workload that you were carrying virtually. That lasted for about 4 weeks, and we had to go make a second round of cuts after that. So we think we're at our lowest point that we can now. We are trying to maintain as much engagement as we can, and therefore the reasoning for keeping as many staff as we can at the least amount of hours. But our payroll is significantly reduced because really it's the only way to reduce costs. I mean, we still have the overhead of running our facility and maintaining it, and preventative maintenance and all of those kinds of things have to keep happening.
Yeah. Well, Beth, concerning any staff members still being paid, and I guess that includes you, what are you guys currently working on? How are you staying engaged when you might not have the full capability or resources you're used to having?
Yeah, so staying engaged and being relevant to the community is still vitally important to who we are and what our mission is for the community. So, departmentally, things like our adult services department are making those much needed calls to the frail elderly and those that we know are home. They're making sure where we have a daily lunch program, those who would come for lunch they're making sure they're coordinating with the Meals on Wheels and making sure those folks are getting the meals that they need every day and whatever their needs may be. I mean, we are isolated, but some of those seniors and older adults are even more isolated now because they can't even have family members be with them. So it's very crucial that our adult department keep those connections. We are proud to say that we have some of our members that are in their 80s and 90s, and we have them on Zoom and doing book discussions and movie reviews. And, we've taken the time to make sure that they can use whatever devices they have to the best of their abilities so that they can stay connected. Our fitness and wellness departments have really risen to the occasion and have gotten onto multiple platforms, and our group fitness classes are running. We have a very robust schedule every week. We've branched out to do family fitness and cooking and meditation, yoga. We have personal training happening, one-on-one personal training. I'm really, really proud of our fitness and wellness department on how they really mobilized themselves and said, we've got this. So our virtual content right now is very robust. We're doing, virtual vacation days and lots of virtual engagement in a way that, we really haven't before. And this is really expanding into a new platform for us that I think will carry over way after we reopen.
Yeah, definitely. So John, what have your staff members been working on, the ones who are still being paid?
Yeah, very similarly. And one thing I will note is we're taking this time to really communicate with our community as well as members that we're still doing things. And certainly we've even asked our members to stay with us going through this time. We've been very fortunate that about 20 or 25% of our members have actually converted their membership to a donation to the Y. And since we're a 501c3, they're eligible to be able to do that. And we've had others kind of put their membership on hold. But very similar to Beth, we've really have been taking this opportunity to really look at ways that we're going to be able to engage with those folks while we're not inside our building. And this is something we've been talking about for quite some time. And I think we've accelerated the process more than we ever have. We've launched a program that's online for virtual wellness called YMCA360.org, and that's currently available to anyone to be able to access it with a variety of online virtual programs that are being done by the Y, whether it's wellness programs, yoga, kids type of fitness types of program, it's all there. We've also partnered with some of our other wellness partners like MOSA as well as Les Mills to be able to deliver their content online as well. But also what Beth had mentioned regarding our active older adult population, which is a very large population that we serve. And certainly social isolation, depression, and anxiety is one of the top chronic conditions facing seniors, particularly those who have lost a spouse. So we've been on the phone since the day we closed, reaching out to every one of our seniors almost on a daily basis with those staff that we still have working, asking questions, how are they doing? Is there something that they need from us? And try to get them connected to some of our services. We have some of our classes that are doing some of the Zoom programming as well early in the morning for yoga. And one we recently started a couple of weeks ago, and we just had one this morning, is we did senior bingo, which has gotten to be a big hit.
We started that today too. That's funny.
Have you done that too as well? It's just been absolutely remarkable. And we targeted our seniors particularly. I think we're going to be opening it up to others as well. And that's been a big hit as well. And then one final one that I think might continue on into this next year. But we've also launched Y Virtual After School program through Google Classroom. And so right now we're doing 2 or 3 days a week right after virtual traditional school that families can log in to our program from 4 until 5 o'clock and be led by one of our counselors through a particular activity for an hour. And we've done I believe 3 of those. One's being done, I believe, this afternoon at 4 o'clock. And again, I foresee us continuing that at some point in the future as well when this is all over.
Yeah, definitely. Well, Kevin, how are you keeping staff members busy? I know you're kind of operating at a little more normal capacity. So outside of cleaning up flood damage, what is your staff up to?
I would say the operations side is doing that, and we've repurposed some of the part-time staff for that. Very similar to what John and Beth said with the virtual programming. We modeled some of our virtual programming off of what the West Coast had been doing for many years. So on our webpage, we have a virtual link for programs. So it's really this. I don't want to repeat what Beth and John said because it's the exact same thing. One thing that I have been surprised is the older adults, active adults, seniors, whatever, have jumped to Zoom, love it, use it regularly. My mother does Zoom exercise classes and then has to call me and tell me about it. I've been amazed. So that has amazed me. The other thing on the other end of the spectrum, we've been doing a lot of Zoom lives with storybook characters. So we've had Trolls Live, we've had Captain America, we've had Belle, several Disney characters where they're live costume characters and they interact with the kids and they can send them questions. That has really taken off. I thought there would be a little bit of a disconnect, but they have loved it. We started around maybe less than 20 for the first one, and I think the one the other day was a couple hundred people. So that's been very unique.
Yeah, for sure. Hey, let me know the next time Captain America goes live. I would also like to meet him.
Okay.
So, Kevin, we'll stay with you. Do you think that the current pandemic and this resurgence, or I guess emergence of more virtual services and programming, do you think that is going to carry over post-pandemic, where users and participants of all ages are becoming more comfortable using technology and adjusting to virtual programming?
I do. I think it's going to be a blended approach. I made the comment to some staff in a meeting the other day that I truly think that as we come out of this, we need to think about potentially repurposing a staff member or two that their sole focus is videography, editing, creating content, because we put so much content out daily. I think I think Beth made the comment to shut that off. I don't see that happening. I think maybe not as much, but we're seeing it used heavily out in the parks as well.
Okay. Yeah, John, this is something you and I have talked about a couple of weeks ago, that sort of hybrid approach after all this is done with, virtual versus in-person programming. Can you weigh in on that?
Yeah, well, to start off with, this whole pandemic is not going to go away anytime soon. I think the repercussions related to this will going to continue on into the rest of the year. And I agree certainly with Kevin that, the idea of looking at virtual as something to be, is still here to stay. However, I still do believe that organizations like all of us that do have a physical presence, having a balance between the two, I think is going to be extremely beneficial. I think people still need human contact and engagement, which is what all of us do it extremely well with, and I think that will continue. Having our ability to be able to balance against some virtual offerings and a lot more on-demand type of services that people can access at any time, I think is going to be kind of towards our future. I do also think that everyone's becoming a lot more comfortable with using technology, to your point, being able to jump on Zoom, and grandparents and other family members who weren't able to do it before are getting a little bit more familiar with it. But ultimately, I think being able to have both, I think is going to be beneficial in the future. And I know a lot of people are ready to get out of their homes and get connected with a live person to start getting engaged. And I don't think that part's ever going to go away.
Yeah, for sure. Beth, how do you see all of this virtual and in-person programming playing out at the Cat's J?
Yeah, I think I agree with both of the guys that, this is going to be something for the future. For us, that personal touch is very important, and I think that's what people thrive on. But I think some of the platforms and some of the direction that we're going with the virtual, when I think about some of our user groups, like our Parkinson's group, it's a little bit of a frailer group. I don't think they're going to be rushing back into the building full of people so soon, and they are thriving with support groups and the exercise classes virtually in a way that is wonderful for that group. And I think it will have to be a blended model. And I think depending on what restrictions are when we are allowed to open and welcome back people into our buildings, maybe, whereas we had a group fitness class that may have had 60 people in it, maybe we can only have 25, and we'll be able to stream live that class so nobody has to miss it. So I think it will be a blended model, whatever that might look like, but I don't think it's going to go away. And I think because people have so easily embraced it, it'll be needed long into the future.
Okay. Yeah, I still love the idea of like what John mentioned, doing, virtual bingo, and I think Kevin mentioned doing that as well with the Rec of Grapevine. It's fascinating to me how seniors seem to be becoming more comfortable with technology. Beth, do you see that as an evolving way to serve seniors?
I do. I think people that might be recovering from an illness or homebound post-surgery or something like that will still be able to feel connected. We have a comedy evening and you can't come, or we have a lunch and learn activity, and maybe we're going to deliver some boxed lunches, and you're going to be able to sit from the comfort of your home and participate in a different way. So I think it will absolutely live on.
Yeah, definitely. Well, John, we'll go back to you for this next question. We're going to shift now to some of the questions from the audience. This one is, have you had any challenges with any particular demographics during this pandemic, and any people that have been a little bit more challenging to be able to serve? Not necessarily because they're being difficult or something weird like that, but a lack of resources or available staff. And if so, how have you worked to overcome that challenge?
Yeah, I think right now we're still learning about a lot of things. Some of the challenges we faced before the pandemic still hold true today. We have populations that are underserved. We live in communities where there's transportation issues. We have areas where there's inequity in terms of service delivery. And we've been working through those prior to the pandemic, and we'll continue to do those. Has there been anything specific related to this as a result from it? Absolutely. A lot of individuals rely on the Y and other nonprofit organizations to be able to connect, possibly for food distribution or for childcare or other types of services that just are not available right now. I think we're still beginning to learn about what some of those are, and I don't know that we fully know the extent of all the challenges that are before us in terms of service delivery.
Yeah, definitely. Yeah, Kevin, can you weigh in?
One of the challenges that I don't think we thought of that most of a certain part of our population is we're 115,000 square foot facility, the one we're talking about specifically. We're right next door to the library. Both of us serve through our computer classes and challenged populations. And when we closed the door, one thing that we quickly learned is we shut off internet access for hundreds of kids. Yes, they had a device because our school district is a one-to-one device, but they had no way to connect their devices at home to continue their online learning. So we quickly retooled, worked with our IT department, and we have hundreds of parking spaces. So we actually set up Wi-Fi nodes out in several of our public parking lots at this facility and some of our larger parks. So the parents could drive there, still stay isolated, and allow the kids to do their homework. That was something that I'm not sure anyone really thought that was going to be a problem, but it quickly was a problem, and we were able. Fortunately, we have a staff that could react very quickly through our IT department. But that was a unique challenge that I don't think anyone really thought through.
Yeah, for sure. I actually want to stay on that. How did you make that happen? Because I assume it happened fairly quickly, you know, to address the need that you saw.
It did. We're somewhat unique. About 3 to 4 years ago, AT&T and Comcast and Fios were coming into town, and the fiber, it might have been 10, it's probably 10 years ago now. It seems like 3 or 4. Long story short, we have installed our own fiber network to every city facility in town, and then we've partnered with the local school district to connect up their facilities. So we have 100+ buildings on our own fiber network that we have unlimited bandwidth. So we were able to just literally come out of this building and the other buildings and come right outside and set up repeaters and hotspots very, very quickly in a matter of days.
Yeah, that's a really unique service. That's really cool. Really cool, Kevin. Beth, have there been any challenges you guys have been overcoming?
I think, our early childhood and our young families, we found were really struggling with being teachers now at home and having a house full of kids and trying to manage their own job and their spouse or their partner and their home life and, keep the kids occupied. And, there was a lot of concern about the families who had children going into kindergarten and the kindergartners being prepared for first grade and missing the last half of the school year. And our early childhood team put together a core group of teachers to provide online content scheduling to keep those children engaged, to give the parents a framework of what to work on with those early childhood parents. It's very different. The elementary and middle schools and high schools have a curriculum and the kids get on and they have their academics and curriculum, and the early childhood families don't have that. And the kids are missing the socialization piece. And it's really pretty remarkable to watch a classroom of 12 4-year-olds on a Zoom call actually learning and repeating and looking at sight words together. And we really help those families, give them a framework for keeping those children moving along developmentally appropriately. While they're trying to balance, so they don't have to figure that out. We figured it out for them, and they can try and balance their life with their working from home and having their children from home at the same time.
Yeah, absolutely. Well, let's stay on this subject. John, we'll go to you. What has been the impact on youth and families during this pandemic, and how is your organization addressing that?
Yeah, I will tell you, the impact of not being able to connect with youth probably has been one of our big challenges. With all the municipalities that we've had and so many different orders coming down, there's been almost a resistance to want to make available additional spaces to be able to meet the needs of youth in our area. And we've had districts and government entities trying to get clarifications as to rules for us to be able to follow. And I think we've done a pretty good job of creating new guidelines on ratios that are below 10, requiring remote drop-off and pickup, and doing the thermal temperature scans. And so this has mostly been in the area of childcare, and also being able to use some of these same sites for food distribution. But we have unfortunately not been able to connect with a lot of the youth that were with us every single day, just because there hasn't been an avenue by which for us to be able to do that. And that has been a significant challenge for us.
Yeah. Well, what do you think the lasting effects from the pandemic are going to be on, that same demographic, youth and families, and your ability to serve them? I know eventually facilities are going to reopen, but do you think there are going to be any lasting fallout from this?
I mean, I'll just kind of tell you, that's a great question to ask in terms of what it's going to look like. It wasn't until just yesterday, literally around this time yesterday, that we were given the go-ahead to start moving forward with thinking about summer day camp, with restrictions that look completely different than what it looked like. In fact, it's probably not going to be summer day camp. It's probably going to be a different version of childcare that's done throughout the day than your traditional camp, where you had field trips and swimming pools and those type of things. So more to come on that. We're probably going to be, and we'll talk about reentry probably a little bit later, but I don't foresee us starting lots of these types of services and programming anytime soon.
Yeah, definitely. Well, Kevin, what's your take on the impact of COVID-19 on youth and families moving forward?
I would say that the inactivity of them, that's a challenging demographic if they're not involved in a organized youth sport or in middle school sports. They don't have a lot of activity as it is, so that's a group that we struggle to get active, and them sitting at home doing online gaming or who knows what does not help with that. So that's, to me, a challenge is going to be for us to try to re-engage and get them active. Those that are already active are continuing to do that to a certain degree, but with all sports canceled, schools canceled, the motivation to get out and train or walk or do something is not there as great as it used to be.
Yeah, for sure. All right, so this next question is actually pretty simple, and it's okay if you're not really allowed to divulge all the plans you have, but I was hoping we can kind of go down the line and you could walk us through, in general, what reopening looks like at this stage for each of your organizations, like the expected date, any plans you might have, and hopefully you can walk us through that. Let's start with Beth.
So we are in the very early stages of this planning. We have no notice yet of when we will be able to open our doors. We're hoping just to be able to open our summer camp program. We run a very large summer camp program in an off-site camp facility in New Jersey. But, some of the models that we're looking at really will depend upon our Department of Health guidelines. Obviously, all the social distancing rules will have to be put into place. We know some of our departments, like our older adult department, will not have to come back right away. We will probably stagger the different departments and amount of staff that need to be in the building to essential, especially to start. Really based upon, what will the influx of members look like? We certainly anticipate much less people, rushing to come into the building, although we know people are yearning for it. And there will be temperature checks, and there will be questionnaires to be asked and answered. And, all the protective, 6 feet apart markers on the floor, and, arrows directing which way you can and cannot walk, and monitoring the number of people. We're looking now at about taking half of our equipment out of our fitness center and putting it into one of our basketball gyms to space everything apart appropriately and keep the same amount of equipment available. And I think we really need to, for us, we really need to get a little more clear guidelines about what we can and cannot do, because we don't have those completely yet. We're getting a little closer to those guidelines from the CDC and the American Camping Association for camp. But other than the general rules that are out there right now. We don't have anything more specific for a building of our size.
Yeah, definitely. And I know that that's all going to vary from state to state, and even, you know, within city to city in some states. So I know it's just going to be, you know, you're going to kind of figure it out as you go. So,
Sure, you know, and you know, we have everything in place as far as, you know, 20 more hand sanitizing stations, and how many more gym wipes, you know, did we order, and how much more signage is up, and all of those kinds of things. But you know, the big questions about, you know, are we going to have to limit, you know, the number of people in different program areas and things like that? We're not quite clear on that yet.
right. John, what does reopening look like for the Kansas City Y?
Yeah, we've been working on this for about 2 months, and so we've got a lot of detailed plans around all of this. And I'll just kind of give some of the highlights on it. As I said earlier, we're 12 or 13 locations in multiple jurisdictions and cities, and we're going to announce next week kind of what our plan is, and it's really going to be done in phases. We're not going to be looking at opening the facilities all at one time. And in fact, we've been communicating with folks this week and last week on all the things that we're doing to prepare our buildings. We've even pushed out some videos to all of our members and participants so that they get a better idea right now of what the facility might look like. So for example, having shields up at the Welcome Center, having directional signage all over the building with entrance and exits at different parts along the way, taking equipment off the floor or restricting access in order to create a physical and social distancing, different types of requirements, shutting down water fountains so that they won't be used, you know, closing off certain areas of the building, and certainly not doing any group exercise classes or any types of gatherings. And so mostly kind of a facility access. We're also having the same conversations regarding our own staff. We pulled together complete training protocols to be able to talk to our staff. We are going to be having some requirements around personal protective equipment that our staff will be wearing. We'll be also doing some of the temperature checks for members as they come in, and start doing some documentation and starting to ask some of the same questions, like, have you been in contact with someone with COVID-19, and are you experiencing symptoms, and those type of things for our existing members. And we're going to be kind of taking it slow. We're looking at maybe, I think, 4 or 5 facilities will get launched, certainly after the government guidelines or the health department guidelines. We're kind of doing it on our timeline. Even though there's been some ability for us to open up sooner in some locations, we're going to wait and do it when we feel that it's right for us. So we'll probably end up with looking at some of those opening here in the next couple of weeks, followed by some other ones probably in the month of June, and then start thinking about the next cycle, probably when we start talking about swimming pools and showers, possibly looking at mid-June for that, and not even looking at other programmings, and probably until mid-June to early July.
Yeah, definitely. And John, we actually just got a question, and I think Beth touched on this already. Do you have a plan for how you will space out your fitness equipment to meet social distancing guidelines? I know Beth mentioned that they're thinking about moving half of their equipment into their gym. Does the Kansas City Y have something similar planned?
Yeah, we're probably not going to start moving equipment to different locations. That probably doesn't make sense for us. I think initially what we'll do is shut down some of the equipment by putting notification on it for it not to be utilized for right now. We're not expecting initially a flood of individuals. In fact, I suspect we'll see about a 75% reduction in the utilization of the facility than under normal circumstances. So for right now, rather than moving different equipment and stuff, we're not going to do that initially. We are, however, removing things that create congregation. So things where we may have had a coffee service or places for people to be able to sit in lobbies, we're going to end up removing those completely from our facilities.
Yeah. Okay. Kevin, what's the plan for the Rec of Grapevine?
Well, same with John. We had a plan in place. We worked on it a couple months. Really, the day we closed, we started working on that plan, thinking in our mind that the governor of Texas would make some declaration. We were planning a June to July 4th-ish. It was kind of in our mind, that time frame. He threw us a curveball Monday at his press conference and said pools could open immediately and gyms can open May 18th. So at a 25% reduced capacity for facilities and gyms. So we've been scrambling a little bit the last couple days. We have a plan in place. We will open Monday the 18th at a reduced capacity, not only reduced capacity, but also reduced hours. Because to staff our facility, we have to reduce the hours because so many of the areas are going to require supervision and counts.
Yeah.
Our facility is not set up to reduce equipment, as Beth mentioned. So we'll do what John indicated is alternate, whether it's treadmills or ellipticals or whatever, alternate units, half open, half closed. We are, based on what we've seen in our parks and botanic gardens, we are expecting a fair amount of people coming day one. So we are prepared for that. As John mentioned, all of our leisure lounge areas, we're removing the furniture from all of those areas. No coffee service. Really, the only food service we're going to continue in the building is prepackaged out of the vending machine, and the game rooms, the stuff taken out. Really strip everything down to the bare bones, other than the track and the fitness and things like that. And then probably a mid-June, 1st of June, start to phase in some of those classes at a reduced capacity, whether it's a jazzercise or Zumba or whatever, and then move into the pools, even though we're not prepared to open the pools. We have about 400 lifeguards to continue to train.
Yeah, so how are you going to enforce some of the social distancing guidelines and some of the cleanliness standards, and really try to help make sure members are kind of abiding by those guidelines? And what sort of preparations are you going to do with your staff for that time?
Yeah, the preparation, or let me talk to the guidelines. So we're not set on our hours yet, but let's just, for argument's sake, say we're going to open at 8 in the morning. We typically open at 5, but we'll open at 8. We would run the facility from 8 to 10. We would do a hard closure at 10 a.m., evacuate the building, or regardless how many of our patrons we had in there, and clean it for an hour. Open it back up at 11. Do the same thing at potentially 2 o'clock, and then until we close, and then another heavy cleaning that night. We would continue that every day, although we stress, cleaning the machines, wiping things down. One thing that was a little unique that the governor put in his order for us is if you're working out or using equipment, you must wear gloves. So we're trying to get a little clarification out of the governor's office. Nowhere have we seen that. So it's going to be interesting to see how that works and really what good that's going to do if you're bringing your own gloves from home and you have an issue. But as John mentioned, we'll do the temperature checks. We've created multiple large posters, kind of checklist, are you X, Y, and Z? Okay, go home or whatever. As far as staff, most of our staff are up to date. We've been doing temperature checks on staff and other things like that. The governor did come out and say it's not required to wear a mask or face coverings. We are providing those for all our staff. We have created sneeze guards that you're seeing at retail locations at all our check-in points. We are pretty much contactless check-in and payment. We will require everyone to do that way over payment is payment online. We will not take cash when we open.
All right.
And who knows what that's going to mean. We're going to learn a lot.
Oh yeah. I think anyone can assume the next few months are definitely going to be a constant learning experience. So John, we'll go back to you. How is there any concern about getting members back into the building? Are there any ways you're going to gauge their interest in returning? Bearing in mind that obviously some of the standards passed down from state governments might have an influence on this. The current climate of, confirmed cases in a certain region could determine that. How are you gonna, flush all that out?
Well, I know we've got our communication going out I think on Monday or Tuesday of next week to talk about some of our reopening plans and phase. We will, as part of that communication, have a part of a very quick survey that will be asking individuals their intent to come back. And if they did, for them to quickly identify that could be morning or afternoon, so we can begin starting to judge some of that type of stuff. The other thing, and I should have mentioned this as part of the reopening plan, was we are looking at hours that are a little bit different, and we're also going to have opportunities for hours that are going to be for only our active older adult population. And those may be a little bit longer in areas where we have a population where we serve more of those and maybe in some other areas, but they'll be designated specifically for that. But that's a really good question. I think initially, from some of the Ys that have opened up earlier on Monday, we've noticed again probably about a 25% utilization. Some are just kind of coming in and kind of checking things out first before they actually want to do things, just to see what is it that you're doing different. I think it is incumbent upon us to make sure that we're very visible, that we are monitoring our facilities, that we are talking about what the rules are as people come in and use different parts of the facility. And I think that will create a higher degree of comfort for individuals to possibly want to come back. But we're not expecting there to be a lot of people initially coming back. And as long as we communicate with our members and program participants of the types of things we're doing, we're going to learn just like everybody else on what utilization will look like.
Yeah, absolutely. Beth, can you weigh in on this?
Yeah, I agree. I think our members need to hear from us as often as possible. We need to make them feel like they're part of the conversation about what's happening for when we reopen. And I also think it's just as important for us to ask them what is the most important to them. We have a survey going out tomorrow, Friday, to all of our membership, and it covers different areas as far as fitness and wellness, older adults, early childhood, after school programming, and all of our basic, service areas. What's most important to you? And we all know everybody wants to feel safe. I mean, that's the bottom line. People need to know when they walk into your building that they feel safe, that you're doing everything that's possible, that your protocols, your policies, your guidelines are clear, and that you're enforcing them. So I think whereas, maybe not all of our staff are coming back and they're coming back in phases or they're coming back in different shifts, we will need more staff in our fitness areas. And I think they should be wearing designated shirts that, that they're not just the floor staff, that they're there for other purposes. And that's enforcing some of the policies and procedures and, doing sanitation and making sure that everything is being held to the standard that we say it is.
Absolutely.
That's a good point, Beth. Let me make a comment real quick. I was at the grocery store last night, and several of the team members actually had like bright neon yellow or orange shirts, and they listed on the front and back sanitation crew, and they were doing the carts, but then they were going around the store wiping down other things. I thought that's a good idea.
Yeah, absolutely. Yeah. So what in general will the industry look like once we're on the other side of the pandemic? I mean, we've discussed a lot of different topics, but I mean, just overall, what's the climate going to look like? We can start with John.
Yeah, I wish I could forecast that for you. One thing I do know is that unfortunately there are going to be a lot of non-for-profit organizations that are not going to come out of this. Just because of what's happening, and I think organizations that are in this industry and those that all do other types of things really have to be part of the solutions for their community and to begin to think about expanding its services beyond the traditional thing of what we know the industry to be. So as an example, I know that we're partnering with our local health department and some other organizations to be testing site for COVID-19. And so again, everything's gonna look a little different. And again, as a 501c3 community organization, we have to start thinking about things of where we have to fill the gaps that are going to be left by services that are no longer being provided in our community.
Absolutely. Kevin, can you weigh in on this?
Well, that's a great question. I've seen people probably not aware what Parks and Rec as a generic term, whether it's a Y, whether it's a foundation. I think our visible image has grown drastically. Whether we're a COVID testing site, whether we're setting up shelters, whether we're doing food banks, whether we're assisting, in the larger cities set up temporary hospitals. I think people will continue to appreciate Parks and Rec, and I think we'll evolve. We always have and always will. So what it looks like, I don't fully know. I think it is going to be different. I think Beth made a comment earlier that how we serve our patrons in the future is going to be a little bit different. But I think, at least I hope, that they want more and we give them more.
That's a good way of putting it, Kevin. I like that. Beth, can you give your perspective?
Yeah, I think this virtual platform, these virtual platforms that we've all kind of jumped into quickly with both feet will continue. But I think that human nature really thrives on interaction and social interaction, that camaraderie, that community spirit and feeling. And I think it will be slow. I think it will come back. It may never look exactly the same as it was, but I think that for us as organizations, this is really a time for us to be looking at how we service our members. We go back to the basics where we all started. To what's really important is our community values and how we service the members of our community to the best of our ability. Will not change. I don't think that will change. And as long as we remain relevant and the service we provide is meaningful and we're transparent, I think slowly but surely it will return, because I think that's our nature.
Yeah, definitely. Well, we have time for one more question, and it can be a short answer. It doesn't have to be anything profound. I just want to know from each one of you, what's the best advice you could offer for thriving, in the midst of such a weird time? We can go around the circle, and we can start with you, Beth.
I think being able to pivot on a moment's notice and make sure you're surrounded with a really good team that are willing to put all their heads together and keep moving. You just keep moving. I think innovation and the ability to be flexible and push yourselves is really very important.
Absolutely. Kevin?
I agree with what Beth said. The other part I would add to that is just simply don't take yourself too serious. Everybody's emotions seem to be a little heightened right now, and I've had to remind many people that it's going to be okay. We're going to come out on the other side of this, whatever that is. Closing everything was easy. We've done the easy stuff. Now comes the fun work, where we get to be creative and we get to be innovative, and we get to problem solve and serve our patrons.
Excellent. And John, what's the best advice you could share?
Not everything needs to be 100% perfect. 75% is okay. Being able to have it 100% executable, I think, is more important than it actually being perfect. So that's the first thing. The second thing is the normal, or kind of trying to get back to normal, certainly not going to happen. And actually, normal didn't work. And normal is what caused some of our issues that we have. And I certainly hope there is a greater recognition to population health and the roles that each of us play in ensuring regarding the health and well-being of everyone here in the United States. And we take that a little bit more seriously.
Absolutely. Well, that's about all the time we have for today. I want to thank you three so much for your time and for being willing to come on this roundtable and talk about how we can outlast this pandemic and do the best we can in this time. This recording will be available in a couple of days on communityrecmag.com, so be on the lookout for that. And I hope everyone stays healthy and happy, and if you need to be, stay at home during this time. And here's to outlasting the pandemic. We'll hopefully see each other all on the other side of it, happy and healthy. Thanks, everyone. Have a good day.
Thank you.